once a resident walks through our doors, they immediately see a difference between other medical centers and ours.
The reputation that the hospital carries, it was my first choice.
The day I interviewed here, I just felt that they were genuinely warm people and that this would be an excellent environment to train in.
A lot of people come to this hospital. It's in a very central area. It's good for tertiary care. So you see a lot of transfers from smaller hospitals, and it just means that this hospital has a good capability to treat more serious problems.
I'm Dr. Patrice Weiss, Residency Program Director and Director of Medical Education in the Department of Obstetrics and Gynecology at Lehigh Valley Hospital and Health Network. But not long ago, I was in your place, a medical student seeking to pursue a career in obstetrics and gynecology and searching to find the right program with a strong mix of patient care, education, and research. And I found that right here at Lehigh Valley Hospital. Many changes have occurred reflecting the growth of our program and department. Our residency program has more than doubled its size from 8 to 16 residents. And at our site visit in January 2007, we received approval from the ACGME for expansion to 20 residents. Our subspecialists include 5 maternal-fetal medicine physicians, soon to increase to a full complement of 8, 2 fellowship-trained GYN oncologists, 2 fellowship-trained urogynecologists. We also have a board-certified reproductive endocrinologist with an IVF lab that is one of only a handful of its kind in the United States. Reproductive endocrinology is expected to expand to 2 physicians and GYN oncology to 3. Our clinical activities include approximately 3,300 deliveries per year, over 900 cesarean sections, over 4,000 major and minor gynecologic surgeries, and a busy Center for Women's Medicine ambulatory clinic with nearly 18,000 visits per year. While many changes have occurred, tradition in the form of dedication to education is still the essence of this flourishing program. I am convinced, after learning more about Lehigh Valley Hospital and Health Network and the Department of OBGYN, you will agree that not only are all hospitals not alike, but all OBGYN programs are not alike.
Well, the gynecology program here I think is excellent. First of all, we offer our residents pretty much everything they need in terms of surgical experience as well as an ambulatory experience. In the office setting, not only seeing routine gynecologic stuff, you'll also get a good exposure to specialty gynecologic issues, including chronic pelvic pain, vulvar disorders, sexual dysfunction, adolescent and pediatric gynecology, as well as menopausal care.
Lehigh Valley Hospital also provides a unique experience in its maternal-fetal medicine ultrasound telemetry unit. We can gather ultrasounds from 8 satellite locations and review them almost instantaneously at our Cedar Crest campus.
There is an extraordinary amount that a resident can learn in our office. The main learning experience is in doing ultrasound, in feeling comfortable with the ultrasound transducer, in doing not only the basic biometry of fetus, but also starting to learn to evaluate some of the anatomical findings of a fetus.
Proficiency is the focus when training residents in all areas of our program, notably laparoscopic surgery.
One of the most advanced laparoscopic skills is to be able to suture, hands-on suture and tying knots, pretty much in the same way we used to do in conventional surgery, but now this time to be able to do it laparoscopically. That is a difficult task that needs to be learned in a simulation lab before it can safely applied in the operating room with patients.
Surgical proficiency is also practiced during a resident's time with the GYN oncology service.
Having a GYN oncologist as part of a residency program not only offers the surgical training, the medical knowledge that hopefully we can provide, but we also get to work with the residents.
The techniques and the skills that they'll develop through the surgical procedures that we'll do will enable them in the future to perform the wide variety of benign surgeries that they'll need to do on difficult cases.
Residents will also spend time training in Lehigh Valley Hospital's Urodynamics lab, using computer technology to aid in diagnosing and treating patients.
This is a urogynecology division and has both component urology and gynecology. Most of the time when a patient comes, they are elderly patients and they have gynecological problems as well as urological problems, and this is the place to treat them both.
The fact that our hospital is a Level 1 trauma center exposes our OBGYN residents to even more difficult cases.
We have a fairly constant influx of pregnant trauma patients, and so one of the advantages I think of the program is the ability to evaluate, work up, and treat patients who are pregnant who sustain trauma.
While residents see a wide range of patients, they also interact with a wide range of medical professionals, making for yet another unique aspect of our program.
I think it's very well-rounded. I mean, we have the reproductive endocrine, urogynecology, GYN oncology, as well as the high-risk obstetrics that I think everybody has, but we also have all the other divisions. I also think there's a focus on business here, not only learning the procedures, but in addition, learning how to make your practice work once you go outside, because there's also a lot of good interaction with the private attendings as well.
As the third year approaches, residents gather their accumulated knowledge and look to Resident Research Day, a long-held tradition here at Lehigh Valley Hospital.
The third-year residents are required to conduct a research project and present this research project at our Resident Research Day. They either are large retrospective studies or prospective analysis of different research.
The OBGYN residency program of Lehigh Valley Hospital and Health Network has continually produced well-educated physicians for 50 years, and we're looking forward to the next 50 years. It's because of a genuine enthusiasm and our dedication to education that makes our program a unique experience for residents.
We appreciate your interest in our program and look forward to hearing from you.